Welcome to the Dogtor Bros, where we have an honest discussion around vet life in and out of the clinic. My name is Brandon, and I'm your doc of the day and your guide through this episode. I'm a veterinarian currently in Iowa, Ames, Iowa specifically, at Iowa State University. I'm a small animal internal medicine resident. I'm here with some of my other good friends.
Hey, I'm Adam. I am a relief veterinarian in Louisville, Kentucky.
And hey, this is Jeff. I am a veterinarian who's residency trained in dermatology out in Louisville, Kentucky.
And today we're going to continue a previous conversation that I actually wasn't really a part of before, but these guys were. We're talking about veterinary myths. This is part 2. So I missed the first one, but we'll jump into a bunch of other myths that we didn't get to talk about in the last episode. But before that, it's just a quick intro. You know, we've been doing these little intro things to kind of let you guys get to know us a little bit outside of the vet med stuff. But something that I think every veterinarian gets asked, at least at some point, is, you know, what dog breed would you be if you had to be a dog breed? And then for fun, we're going to kind of like guess what other dog breeds each other would be. So these guys have been thinking, I kind of have been thinking, we'll kind of all just decide for Chris since he's not here today. But for myself, my initial go-to was going to be a golden retriever. So I'm pretty I think of myself as athletic. I'm not the most athletic person in the world. I'm not running marathons every day, but we do a lot of fun stuff. I'm an outdoorsy guy and pretty happy-go-lucky, good attitude, kind of go with the flow, happy to be around people and hang out. But I'm not really a large breed dog. I'm relatively short myself, I think, comparatively. So that being said, Nova Scotia duck-tailing retriever, really cool breed. One of my dogs is half duck-tailing retriever. They're basically a mini golden, but with a little bit of a more red fur. So that's what I think I would be. And they are, you know, if you go to a couple of different websites, they'll tell you a couple of different things, but great outdoors, active, very energetic. So I consider myself to be in that realm, in that category. For Jeff here, I'm sure he'll be happy to tell you that he is a big Georgia Bulldog. I don't really consider him. I don't really consider him an English bulldog, but I think that I would consider you like an American bulldog. I think that would be pretty fitting.
Continue.
They're described as loyal, self-confident, and they are, athletic, well-balanced, have a great friendly attitude. So I feel like those are some pretty good traits to describe Jeff here. I don't know if you'd agree.
I mean, I guess I'll take it. I always struggle. I always struggle with this question because we always ask in the clinic or whatever too. I always feel like I give a bad answer. I don't know because other people have described me as a Frenchie. I've got multiple brachycephalic breeds. I don't know how I feel about that. I can breathe. Ironically, I'm sick right now. I can't actually breathe. So there's, God, I feel like I'm digging a hole. But you know what? I accept that. I will accept American Bulldog because I don't have anything better to offer for me.
And then I guess to finish out we'll save the best for last, I guess, Adam. But for Chris, I was going to say a lab. I feel like that's pretty
100%.
I was going to say lab.
Spot on for
We're all
Chris.
going to say lab.
Friendly, athletic, good attitude, family oriented. It's just like Chris in a bundle.
Think of Chris as those dogs that literally shake, wag. He's got the happy tail going on. He wags his tail so much his entire body moves, and there's just a wave, and his tongue is out, and he's excited, and he wants to go play frisbee immediately.
So yeah, that's what I think of Chris. And then for Adam, I'll be interested to get your take on this. I thought of you as a mixed breed dog, which can go a lot of different ways depending on the type of mixed breed dog you are, but considering your background, and we've talked about this in other episodes, where you've kind of been all over some different aspects of vet med and have a lot of different experiences in different parts of vet med, from USDA side, I know you're doing the relief work, all that stuff. I feel like it's a good spot for you, and you can kind of take it as you like, because there's a lot of different types of mixed breed dogs out there.
Well, I had myself as a golden retriever.
Okay,
but
that's fair.
I can take mixed breed. The reason I put myself as a golden retriever is because I tend to be a people pleaser to a fault, and I feel like that's kind of what golden retrievers do in the best possible way. I did have Jeff as an English bulldog because of Georgia, but then also he could fix his own skin issues, being a dermatologist. So I think he can take care of himself there. And then Brandon, I had you as a Doberman.
Okay.
Like you said, athletic, but also disciplined and smart, going down the internal med route. So that's kind of where I had you at.
If only my legs were that long.
My legs are that long. as the tall one on the podcast.
All right, good stuff. Well, as far as today's episode goes, going back to myths in vet med. So yeah, there's plenty of myths out there for vet med and associated with pets. Again, we primarily do dogs and cats, but there's a whole bunch of myths all across the board. So I think one to think about, this is probably something that people will be like commonly associate with dogs, is like dogs, the classic cartoon is like a dog eating a bone. Should dogs eat bones? Should they be allowed to eat bones? Is that part of a normal diet? So I'd be happy to kind of just open up the room to anyone's opinion, and we'll kind of just see what everyone has to say.
This is Jeff. So ironically, I always thought that was interesting until I got to vet school, because bones are not good for dogs' teeth, and I don't think a lot of people know that. I think we had either a dentist come and speak to us in school, because we didn't have our own official dentist during those rotations. But anything, I remember being taught anything that you hit on your knee, if it would hurt your knee, then it's too hard for a dog's mouth. So bones, I actually discouraged from that point on, because they can cause slab fractures, which obviously you'd want to avoid unnecessary fractures in their teeth. So products like the harder, maybe not harder, but the firmer rubber toys that you can get at pet stores are a little bit better. Like the ones you can put peanut butter in, or little treats in, are great, but avoid the harder, super hard products.
And this is Adam. The one thing I'll just add to that too is that if you have a dog like the Golden that we had, they'll chew on the bone for like a second and then try to swallow it whole. So you want to worry about things like esophageal foreign bodies at that point. If they gnaw off part of it and it's sharp, and then they ingest it, you worry about possible punctures. So there's all the teeth issues that come with that too, but there's some GI problems that could potentially come with that too. And if it's a bone like a ham bone or something like that, you could worry about something like a pancreatitis, gastroenteritis, something along those lines too. So yeah, there are certainly a lot of precautions that come along with feeding bones.
Yeah, I totally agree. And especially with what you guys said, usually eating a bone is associated with eating something else that was also cooked, like steak or ribs or something. And like Adam just said, something nasty like pancreatitis is not fun for anyone, especially the pet that gets it. One thing that I've actually had to deal with more recently here is patients that chew on a bone and then get what's called an esophageal foreign body. And those patients, I see it in small dogs to larger dogs. We had a dog that They ate a bone. It was like a rib bone. Part of that rib bone was swallowed, got stuck in the esophagus before it dropped into the stomach. Owners didn't really realize that the dog was having a problem until they were like, oh, he's not, eating very well, not eating as much, but still eating, still passing food. And then after doing a little bit of workup, usually an x-ray is sufficient. You do a x-ray of the chest, and you can, just see that bone sitting in the esophagus, and it can be really dangerous, especially if it's in there for more than like 24, 48 hours. They're at like a very high risk of that bone. If it's stuck in there for so long, it can just cause an ulcer in the esophagus and potentially even perforate the esophagus into the chest, which is oftentimes fatal. So, when that happens, especially if it's early on, we can go in there, manipulate it, either push it into the stomach. Dogs are capable of breaking down bone in their stomach, or ideally pull it out completely. But the dog that I had, it was a little bit over a month ago now, had one that was stuck in there for like 5 days, which is usually not great news. And by the time we went in there and pulled it out, fortunately, it didn't perforate. Fortunately, the dog did fine. Kept it off food for 24 hours. Gave it a lot of different meds to help minimize acid reflux and allow that area to heal. And the dog's okay, but there was like essentially a crater where that bone was sitting in that esophagus. And it was gnarly. So if anything, that's one reason not to do it. But there are plenty of other reasons, as you guys described. All right, good stuff. Well, something else that's pretty close to the heart of my colleagues in cardiology is grain-free diets, boutique diets. They call them BEG diets, BEG standing for boutique, exotic, or grain-free diets. And the reason that this is important, like for dogs specifically, is there's just shown to be a correlation with these diets and an uptick in a disease called dilated cardiomyopathy in dogs. And it's just something that right now there's still a lot of investigation being pursued at multiple institutions. And there's actually an update. I just looked up, like the FDA is kind of holding off on consistent public updates until there's more data out there with the link between dilated cardiomyopathy and these diets. But there are FDA resources for any pet owner out there that is interested in kind of looking into the research and the link between these diets and dilated cardiomyopathy. So just kind of out of curiosity, have you guys seen a dog that maybe was on one of these diets and potentially developed this condition because of the diet alone?
This is Jeff, and I have had one. So this is always like a controversial topic as it's still pending, and I've done enough research on it and read several journals about it, and my understanding is that there is a correlation, but we don't know the exact causation between these diets and DCM. So my one case, it was actually when I was in general practice, it did develop dilated cardiomyopathy, and it was a very young dog. It got worked up. The owner actually was really on board with everything, to be honest. Got a workup by a cardiologist. They diagnosed it. I actually called the cardiologist, and really the only major change was diet related. So they did think that it was likely related to the diet, and the owner was super responsive and made adjustments. But what we didn't know, and obviously this was years and years ago, so I don't know how that dog is doing now, but it was otherwise healthy, doing well, started on some medications. But my discussion with the cardiologist was, we're not sure if it will be able to come off of medications or not. So we'll start the appropriate things and some supplementation, some vitamin supplements and some other heart medications, and just kind of see how it goes. Schedule another ultrasound of the heart in 6 months. So that's always my worry is, with any dog on these diets. So I tend to lean away from them as well.
And this is Adam. I've had, obviously you get the clients coming in saying that they're feeding a grain-free diet, and I always have that conversation with them about the possible link there with DCM and the potential risk involved with that. I think I've had one, maybe two, that has developed cardiac disease after being on a grain-free diet. We didn't really go too far down the path of correlation with that in terms of trying to relate it back to the grain-free diet. But there have been 1 to 2 that I've seen where that has occurred. I do have a follow-up question on this for the dermatologist in the room. I have had several clients who have dogs with allergies who have said that they have switched to grain-free diets and have seen benefits of those diets with the pet's allergies. So my question to you is there any truth to that in terms of the grain specifically, or is there some other protein or some other source in the food that they're eliminating potentially that's actually causing that benefit? Or is it all just kind of placebo effect due to marketing? What have you kind of seen with that?
No, I think you're probably exactly right, and that for the listeners out there, the correct way to determine if diet is going to be a part of a dog's allergies is ideally an 8 to 12 week diet trial on a prescription diet. Prescription so that we can, because there's only a few companies that check for cross-contamination, but certainly after that, not every pet ends up on long-term prescription diets, and then they will switch to something often over the counter that's limited ingredient. And a lot of those limited ingredient diets out there, especially when grain-free was getting popular, that exploded. So from an allergy standpoint, there are still an extremely, extremely small amount of dogs that actually have any sort of grain allergy. So that's not really a concern at all. I think you're exactly right on the fact that some dogs are probably getting better most of the time because they're switching to something that's a novel protein for them. So a protein they've never had. And so they're inadvertently doing a diet trial. So, if the dog happened to be on a chicken and rice based diet and then they switch to a popular brand that has predominantly lamb in it or predominantly venison or something that it's never had before, they're doing kind of an unofficial diet trial at home. And more likely than not, they are probably getting better because they've switched novel proteins to something that is helping the skin. It is pretty unlikely that it'll be related to the grain.
Yeah, from what I had known, that was kind of what I was thinking. That I'd always heard that grains were pretty low on the list in terms of food allergies for dogs. And anytime they tell me that, I try to still have that conversation with them about possibly switching to another either novel protein diet, hydrolyzed diet that's not grain free. And some clients are open to that, some aren't. Even with me talking about the potential, hazardous effects with the potential risk for DCM, some are saying, "Hey, the dog's doing better. I want to stay on this." And all I can really do at that point is give my opinion, and they can do what they feel is best for the pet, and that's fine. But yeah, that was just something that had come up, so I thought I'd get your opinion on it.
Yeah, I mean, it sounds like you're handling it well. I kind of have the same conversations, and you can just kind of do your best and see how things shake out.
Awesome. Yeah, and as far as the dilated cardiomyopathy goes, I saw, I think 1 or 2 when I was a GP. I still see them occasionally. A lot of times now, I'm not really focusing on cardio workups, but we'll send things over to cardiology when indicated and when needed. And yeah, I'll still have the conversation about shifting the diet if the owner is, maybe unaware of some of the things that are out there, or is, on the diet where, here we have evidence of DCM, and maybe some of this is reversible. And that's something to just kind of end on. If these changes are noted and it is diet related, some of it can potentially be reversible. So moving on, another myth is, something that I think all of us have dealt with is vaccination. There can be a stigma around vaccines in general. There can be a stigma in vet med about specific vaccines. Vaccines themselves, I think, save lives, and there are good aspects of vaccines. There are bad aspects of vaccines. So just kind of opening it up to the room. If as far as like making recommendations for owners, what are your guys' thoughts on vaccination? I think just to start with myself, I think vaccination is very important, in particular for rabies, especially. If there's one vaccine you're going to get for your dog, rabies is number one. That is a disease that people don't think about much anymore, but it's still out there. It's still in wildlife populations, and it's something that we can get as people as well. It's zoonotic. So that's number one. And then legally, most pet owners in the States, depending where you live, are required to have rabies vaccination on board. I think there are only very specific circumstances where it is not required. And we can maybe get into, I think you guys have maybe heard about stigma between certain pet owners and maybe breeders about leptospirosis vaccination. But I will kind of open the floor to you guys as well.
This is Adam. I obviously totally agree with what you're saying about the rabies vaccine. It is still out there, and it is extremely deadly, and it can be transmitted to humans. It is the law to have your pet vaccinated for rabies, so that's obviously top of the list. The other core vaccines that we typically recommend are the distemper parvo vaccines, which protect against common viral infections that can be transmitted from dog to dog, and then the Bordetella vaccine, which protects against upper respiratory diseases. With all these vaccines, again, they are recommended kind of as a standard, and then there are other vaccines that we kind of recommend on a case-by-case basis, depending on the pet's day-to-day life. So even with the Bordetella, really, if they're in a situation where they're going to a lot of dog parks, they're going to grooming a lot, they're around other dogs a lot, we may recommend that every 6 months as opposed to once yearly. Other vaccines that dog may need would be the influenza vaccine to help protect against canine flu, which was a really big issue a few years ago and is still out there. So that's another one to consider. And then you have your other vaccines like Lyme, like Lepto, for dogs in endemic areas, and that's found in a lot of places. I went to a CE a while back talking about Lepto, because kind of like what you said, some owners, some breeders are kind of hesitant to give those vaccines because historically they have been known to have maybe a slightly higher rate of vaccine reactions, and I'm not saying those don't exist. We do see those. But again, educating the client before administering the vaccine, on what to watch for with that. But what they were saying in that CE was the most common type of dog that is actually seen with lepto are small breed dogs. I mean, most lepto infections that people would think of would be dogs that are out a lot. So labs playing out on the farm, or, coonhounds out hunting, dogs that are out and just outside working dogs. But actually what we're finding is that small breed and toy breed dogs are becoming a lot more common in terms of lepto cases, because they're not being vaccinated as routinely as the larger breed dogs because of that fear of possible vaccine reactions. So that's something that I found interesting, and something that I do try to educate clients on in terms of when I do try to recommend these vaccinations for them as well.
Yeah, lepto is something I see more than I'd like. In Iowa, we have it's endemic out here. It's endemic to a lot of areas in the U.S. It's really a disease of, unless you're living in the desert, you're probably gonna have a pet that's exposed to lepto in one way or another. I remember when we lived in Denver, there was a huge it was like a local news segment about leptospirosis, and there were two dogs that were like living in the city and got it, and they suspect it was from some of the rats that were in the city or in the home that they were living in or around the home that they were living in. I like what you brought up. There's definitely a study out there about small breed dogs being a little bit more predisposed. I think it's all relative. Personally, I've seen dogs from small breed to large breed. In Iowa, in particular, there's a lot of dogs that we see that have a lot of access to land, and this is the perfect time of year. It's warmer weather. It's raining on and off. The wildlife's out and about. We see it relatively often. Sometimes it's relatively straightforward to identify with different tests. Sometimes it can be very tricky, and the treatment itself is pretty straightforward, but the long-term effects can be severe. If you have a dog that gets it, oftentimes it's going to cause an acute kidney injury and potentially an acute liver injury as well. And in those dogs with a severe acute kidney injury, I mean, that can cost them years of life down the road if their kidneys are significantly affected and don't have adequate recovery. So I think that's a big one that there is a stigma around for some reason with breeders. When I was a GP, it was definitely the case. I had clients specifically tell me that they didn't want that because their breeder told them not to, while we lived in an area where they could definitely be exposed and potentially not only get that illness, but have long-term side effects or even die from that illness. So I think that one's a really big deal.
And this is Jeff, and I'll say, I mean, I have very little to add, but from derm side of things, or let's say vaccines in general, they're helpful. They're the reason a lot of diseases have been borderline eradicated. And we do get things like parvo season, where it's common puppy time, and they're more susceptible because they're so young, and we do see waves of these things come through. I do vaccinate my pup for all the things and all the cores and a couple of the others as well, like influenza and bordetella, at least yearly, because he does sometimes go to places with other dogs. And although reactions are extremely rare, that's probably the most important thing, is that reactions are rare and should be reported. And if you notice something, go to your vet, have a discussion with your vet in general about what vaccines make the most sense for your dog. From the dermatology side of things, we will rarely see some reactions that cause a vasculitis or cutaneous vasculitis. And so I occasionally, I can probably count on one hand in the past 4 years that I've been working at my current practice in dermatology only, like how often we see them. So it is quite rare. It can happen, but no medicine is perfect. And I think the good far outweighs the negatives.
Awesome. Yeah. Like, I'm glad you brought up parvo. Very preventable disease, very devastating disease, in puppies especially. And don't think that if you have like a 1, 2, 3-year-old dog that's never been vaccinated that they're immune just because they're older. When I was an intern, I saw like a 1.5-year-old dog that got it, and that patient actually ended up passing away because of that disease. So it is a very important vaccine to get, especially at a young age. Moving on to at least one more myth, and I'll kind of bring this into more derm focus here.
Woo!
Indoor only pets can't get allergies. That's something that some people think is the truth. And I'll kind of add not just the derm side of things, but other kind of allergy-like diseases like asthma in cats. Sometimes people think that their cat's immune to certain things if they're indoors only. That's not the case. So maybe I'll open this up to Jeff, our resident dermatologist, first.
Yo.
What are your thoughts on this topic?
This is Jeff, and I love this because I have had it occasionally in dogs, but I think it's more common for my feline cat owners and some vets too, surprisingly. or maybe think a little bit less about it. So the way allergies work, if you think of environmental allergies, anything that makes people kind of sniffy, coughy, sneezy due to pollens is super common in dogs and cats. So on one side of things, you think of the pollen allergies, dust mites and indoor things like molds and storage mites and other things are also super common and cause all of our animals, for the most part, to be, well, in derm world, to be very, very itchy. In Brandon's world, probably mostly asthmatic patients. But from the pollen standpoint, so most people, when they think there's no way my dog or cat could have allergies, I think that mindset or that myth comes from not understanding that pollens are designed to move through the air. And don't quote me on the exact number of miles, but we know, I'll be broad and say we know that pollens from trees have been found offshore, like hundreds of miles offshore. So they're designed to flow through the air. So getting into our houses is not a problem. Most people who have allergies probably experience them indoors and outdoors. And I try to relate that to dogs and cats that are itchy. Cats sometimes are trickier because they hide their allergy signs. So if you think of allergies as causing itchiness, in relation to licking and chewing and scratching at themselves, all of that is an itch response that's super common. Cats will go and hide to do that. So sometimes all you see is a naked belly or where the hair has gone on them because I don't know if they feel vulnerable and they go away or wait till you're out of the house. But I think that's one thing that trips up both veterinarians and owners as far as the brain disconnect. Well, how can they possibly have allergies if they're only indoors? But two things are true. Pollens flowing through the air, super, super common. They have no problem getting into our homes. And then also indoor allergens are very common. Dust mites, storage mites, molds. When we do allergy testing, we include even human dander because they can be allergic to us, and cat dander for dogs and dog dander for cats. So there's so many things related to disrupting the immune system and causing allergies that it is absolutely true that indoor-only animals can be very, very allergic and very, very itchy and or asthmatic.
What he said.
So I love that one. I love it.
Yeah, no, it's great. Yeah, and like asthma, I think allergy is less common for like dust from cat litter, but that's another thing that is an indoor-only kind of problem for our cats, and underlying dermatologic allergies can actually like worsen some of the asthma signs in the cats that I see with asthma. So I think it's very important for owners to just at least understand where some of these problems are coming from in their pets and why we make the recommendations that we do to treat them. So I think that's awesome. Something that we can probably end on as far as myths, we could, probably make like a whole series on this topic and myths. So we'll probably have to do another episode down the road. But
maybe. You
never know. But something that I think we can all contribute to is at least I feel like it's not a big deal here, but there is, in the US, I should say, but there is a stigma around getting your pets neutered in some areas and spayed. There's thoughts about like, oh, well, if I have, two dogs, one of them's a male, one's a female, maybe I'll get one of them fixed and leave the other one intact, or vice versa. There are pros and cons to spaying and neutering, and I think it's less about they don't need to be spayed and neutered and more about understanding why we're spaying and neutering dogs and cats. It just as an aside, like in some other countries around the world, it's uncommon to have or less common, I should say, to have your pet spayed or neutered. But there are some things, and I actually have some friends that are overseas that had to deal with one of the problems with not getting your dog spayed, and we can go into that here in a minute. But as far as spaying and neutering, like what are you guys' recommendations to pet owners out there about why it's so important?
Yeah, this is Adam. So yeah, I do recommend to all my clients really the benefits. I at least relate to them the benefits and why I'm recommending either a spay or a neuter. Obviously, for females, I do recommend a spay if they don't plan on breeding. We can avoid unwanted pregnancy. We can avoid things like pyometra, which can be life-threatening, hydrometra, tumors on the ovaries. So a lot of different things that can be avoided. And there's a lot of benefits to spaying. If they spay them at an early age before their heat cycles, it can reduce the risk of mammary tumors later in life. So a lot of benefits that come with that. Now, in terms of neutering, again, reduce that rate of mating behavior. So for them seeking a mate. In some cases, if you do it early enough, can reduce certain aggressive type behaviors too. There's some debate on that, I'd say, but big thing is that it eliminates the risk of testicular tumors, and then also reduces the risk of certain prostatic diseases such as benign prostatic hyperplasia. So I do recommend both spaying and neutering to almost all my clients. Obviously, everything's a case-by-case basis, but vast majority of my clients, I do recommend it, and I at least take the time to kind of go over the benefits of it and let them know why I am recommending it. Because I'll be honest, even with some of my clients, it is kind of a foreign concept to them as to why they would even need to get their dog fixed or get their dog spayed or neutered. So I do try to take that time to go over the benefits of that and why I am recommending that.
And this is Jeff. And I'll say, certainly from, I think most veterinarians will say, yes, you should still get your pet spayed and neutered. I know that there has been some additional studies out there for larger breed dogs as far as waiting a little bit longer in relation to bone development, I believe. I actually have a large breed dog who's neutered at 6 months, or maybe even 5 months. I got him at 6 months. I think it was 5 months. So depending on who you talk to, that was probably a little bit early. And maybe he'll be more arthritic in the coming years now that he's 8. I don't know, but he was a Humane Society dog, and of course it is, they spay and neuter as soon as they think it's appropriate, and I have no problem with that at all. Some teams spay neuter, but I see why some people wait later, so sometimes it's just a conversation. But I will mention, there was one time I was in general practice, and I had a patient who had a pyometra, and I recognized it and diagnosed it, and fortunately got them into surgery. But I was worried about the life of that dog because it had never been spayed, and it was an older patient. I don't remember its exact years, but let's say 8 to 10, somewhere around there maybe. But something completely preventable, and the owners were actually really, really kind, and just no one had told them to spay their dog. And so it was really just like I happened to be the vet who told them when they came in, because the dog was feeling not good, and had a conversation, and they were actually super receptive. So I guess that's my message to everybody listening. If you are a veterinarian and you just happen to see an intact dog, make sure you have that client communication moment, just to make sure you have something written on your books. Even if you're like, oh, well, they're intact and they're older, they probably are going to be averse to this. Don't just assume. You know what assuming makes us? I'll just say that. And if you don't, Google it. But you shouldn't just assume that somebody's averse to something, because I wonder if that's what happened to my case, that I had to take to surgery, and that dog did end up doing very well, which is great. But faced with a life-threatening thing, just because nobody had really communicated with them, and I think we just kind of let it go, and then they end up putting the dog ends up in a life-threatening situation that was avoidable.
Yeah, I think pyometra is the big one. That's the one thing that happened to some of our friends, my wife and I's friends over in the UK. Their dog developed pyometra, got spayed fortunately, and is fine, but It's something that I've seen multiple times. Both when I was a GP, when I was an intern, saw a dog that unfortunately died from it when I was an intern because of how sick they were, and how long they had been sick. As far as like spaying and neutering, I think the big thing in the U.S. is just minimizing the number of unwanted and shelter pets that are out there, and that's something that like Adam touched on. If you have an adult male dog that's like 1 to 2 years old, they are going to be looking for a mate just by nature. And like he said, that puts them at increased risk of things like getting hit by a car if they get out of their yard or something else. That drive is very strong. But preventing unwanted litters of puppies and minimizing the increased number of pets in shelters and pets that are unfortunately put down because we have too many of them to care for. That is still something that happens to this day, and spaying and neutering prevents that. So I think all of us here are pro spay neuter. Of course, there will be situations where it's not the best option for a dog, or there are still breeders out there. Breeders have the right to breed pets, and there are some good breeders out there, and we should support them. But in the big scheme of things, not everyone's a breeder. 99% of clients out there are not breeders. So definitely get your pets spayed and neutered. And I think, that we'll kind of end it there. As far as kind of a parting comments, do you guys have any kind of last minute recommendations for pet owners that I think you guys maybe talked on, like using Google and Dr. Google as a tool potentially in the last episode, but like as far as kind of resources for owners, or at the very least, like recommendations for owners that want more information on different diseases, like what do you guys recommend?
This is Jeff. I can go. So first, reach out to your veterinarian, see if they have any favorites. Google. We did mention it a little bit in the last episode, and it's not a dirty word. Make sure you're using reputable resources. So something with a university attached to it that has a veterinary school is probably going to be a good resource. There are other resources out there, like literal journals. So if you are so inclined and feeling very, very much like a student, you can actually go to Google Scholar, and there's lots of veterinary journals with really legitimate studies. And I'm very open to receiving that information. So if a client brings something interesting to me and has a question, that's always a great way to start. And a lot of those things are free.
And this is Adam, and I would totally agree. A lot of things with the university attached to it. Also peer-reviewed articles, just like in Human Med. That's where you're going to find a lot of good information in terms of what you're looking for. And one other side note here, because I actually thought this is where this question was going at first. It's just like a piece of like advice to give clients. One thing I'd recommend is to consider, especially in older patients, just doing yearly blood work on them. Just healthy, routine yearly blood work, because we don't really see that a lot. A lot of times in GP, and it kind of depends on where you're at, but a lot of times we'll do blood work when the pet's sick. But doing that yearly blood work, especially as they start to get older, we can catch things a lot quicker. I actually had a cat today that we ran blood work on. It was there for vaccines, just routine, healthy checkup there for vaccines. And we ran blood work on it, and we diagnosed it hyperthyroid, just right there. So definitely something that I would recommend, just doing that yearly blood work, especially as your pets start to get a bit older.
It's literal music to my ears. I can't... I can't explain enough how happy that makes me that you said that. So in internal medicine, we end up usually getting some pretty sick patients, and reference blood work, whether it was 6 months ago, whether it was years ago, can go such a long way. If you have a pet that we're trying to figure out some really terrible disease and we don't have all the information yet, but we do have that your dog or your cat had blood work 3 years ago, which looked like totally normal. Their kidney values were this, their liver values were that, everything, their red blood cell count, white blood cell count was this and that. That is such an important reference point for some of our patients. And I cannot recommend that enough. It is so simple to do when your pet's healthy. And getting it done, serially every year, especially after the age of like 5 or 6, is a big deal because like Adam said, you can catch a relatively straightforward disease to treat, like hyperthyroidism. And for anyone that's dealt with hyperthyroidism, believe it or not, your pets can get actually really sick from that if you don't catch it appropriately and treat it appropriately. So I love that recommendation. Something that I was just going to add to that, I'm full disclosure, I will be working in corporate practice, and there's a lot of corporate practices out there, and a lot of them have different little, like, if you just Google, there's clinics like Banfield, VCA, Blue Pearl, there's a whole bunch of them. But some of them will have like designated little tidbits for owners about different diseases. You can easily Google that. Those are reputable sources, different veterinary clinics that are established and out there, and they can give you some basic information. At the end of the day, like Jeff said, talking to your veterinarian is probably the most straightforward and foolproof way to go as far as getting information about diseases or any concerns with your pet. And I can't speak for every vet out there, but I would be happy to talk to an owner that is just trying to get more information than have to deal with a pet that is potentially on death's door when a conversation could have been had much earlier. Thank you so much for listening to the Dogtor Bros. If you enjoyed it, please leave us a 5-star review on Apple Podcasts or anywhere you listen to podcasts. It would also help us out if you could share this episode with others who may be interested in today's topic. You can also tell us what you want to hear and drop suggestions in the comments or shoot us an email at thedoctorbros@gmail.com or DM us at the Dogtor Bros on Instagram. You can reach me on Instagram at DogtorMasonIM.
And this is Adam. You can find me on Instagram at Dr. Adam DVM. That's DRADAMDVM.
And this is Jeff. If you want to reach me, you can find me on TikTok and Instagram at DermDrJeff, DermDogtorJeff.